Hello, this is Dr. Khan, Executive Plastic Surgery. So very interesting case, nice patient from California. So she had what is breast cancer on the left side, and then ended up getting the mastectomy, nipple included, and she ended up getting a silicone implant after the tissue expander was placed. Interestingly, she had a bad scar, and the surgeon put in a steroid shot only to kind of puncture the silicone implant that she had, like within the first year of having had her silicone implant. So she got a second set. So as you will see, in 2013 she had the tissue expander implant. In 2014 the scar was basically injected with steroid only for it because it was a very thin superficial implant placement. And so the steroid injection unfortunately occurred into the implant, so that had to be replaced. So this is an implant, silicone from 2014, and left breast cancer. The right side is basically untouched, so only the left side is where she had an implant. So as you will see, this is the left mastectomy scar. This is the artificial nipple that was created. You can see the scar here, and this is that scar, that wide scar, and very thin flap. If I go put my finger here, you can see the stitch marks the 12 o'clock for orientation purposes. So if I go pull this, you will see how thin the scar tissue is, and the implant literally was right there. And so this is the lateral, this is the medial part, this is the entire implant capsule removed as one system. Some tissue that I removed, I'm going to send along with the capsule, and I'm very happy. Very thin areas of the capsule, some areas relatively thick, so I incorporated all of this tissue. As you can see, it does not look or feel normal. So 100% total capsulectomy performed in what is a 11-year-old set of implant on the left side. If I go like this, you can see how thin this is. Complete total capsule removal. And as I pull this out, you will see an intact implant. There's some fluid on the back. If I go, look at this. This is your leaching of the silicone, the gel bleed that's occurring. And this is your Allergan style 15, 339, just like the patient stated. Relatively small implant for a patient with a mastectomy. And you can see, look how thin this capsule tissue is. You can see my glove. This is the area. Some areas very thin, some areas relatively thick. All of the scar tissue, capsular tissue, inflamed tissue has been removed, you know, and so overall I'm very happy. Some calcifications starting to form right here, but overall I'm very happy and content with how the whole dissection has gone. So the implant will be returned to the patient. Capsules to be sent along with the smallest piece to be sent to pathology, rule out the BILC, rule out breast cancer, rule out any lymphoma. The left mastectomy scar to be sent as well separately, and then we will see ultimately how the patient benefits from the explant. This is Dr. Khan, Executive Plastic Surgeon.